My name is Kim Mitchell, and my goal today is to teach you about my academic journey. My primary objective is for you as a learner to understand what brought me to the world of teaching mother-baby nursing. So I started my undergraduate degree in 1980 at the University of Illinois, and I decided to study anthropology because I was always interested in the history of people. And in my last semester, I read a book called Birth in Four Cultures. And it was from this book that I learned about midwives internationally, as well as in the United States, where most people become nurse midwives. Do you know what a nurse midwife is? So a midwife is a nurse who is trained after getting experience in delivering babies. They're trained at the master's level to become a deliverer of babies. They work with pregnant women throughout their pregnancy, and they become like an obstetrician, but they are called a midwife. Having babysat for most of my life, after I read this book, which I still have after 30 years, I decided to become a nurse midwife because I felt that it was my calling. I went back to school a few years later, and I became a nurse when I was 28 years old. I moved to the state of New York, where I had the honor and privilege of working at a hospital with Hispanic women. And here's just an example of one patient that I worked with. And in addition to learning Spanish, I also was able to work with a group of women who valued and wanted natural childbirth. And midwives in general offer natural childbirth to patients, although they are open to medication if that's what people want. So I felt like I became a midwife working with these women because I learned how to best care for them in a natural labor state. And because of that, I was learning the art of natural childbirth, which was really nice. So after 5 years, I felt ready to start my master's degree. And I started it in New York. And 2 weeks later, I found out I was pregnant. And I was 32 years old. And 9 months later, I gave birth to Jane, my daughter. About 3 years later, after being her mom for 3 years, I found out I was pregnant again. And I gave birth to Paul. And by then, I was 35. So in addition to working as a labor and delivery nurse and taking care of my babies, I did not feel ready to start back to school. And by the time I did feel ready, I was 40. And I had worked nights a lot in labor and delivery, and I sort of learned what it was going to be like to be up all night, because most babies are born in the middle of the night. So I continued working and caring for my babies, and they were getting older. And one day I was at work, and I met a student who was there from a local school doing an internship. And I decided that I would like to, teach her for the day. So I took her for the day, and I taught her everything I knew about childbirth at that point in a 12-hour shift. And at the end of the day, she said to me that my love of childbirth was contagious and that I should become a mother-baby nursing teacher. And she told me that was my gift. So that fall, I went back to get my master's of nursing. And instead of delivering babies at 2 a.m. now, I get to teach students about the magic of childbirth during normal hours. So now I teach students, and this is one of the books that we use, and everything in here is information about how to be a labor and delivery nurse and to care for mothers and babies in the best way. So that brings me to the end of my presentation, and let me summarize by saying that there are many avenues in nursing, and sometimes you may think you know what you would be good at, but life experiences teach otherwise. And I'm a teacher, and I love it, and it is my true calling. Thank you.